Millions of Americans traveled for the holidays this past week, and more are expected to do so for New Year's this week. Health officials are warning that could mean a spike in coronavirus cases as the total number of infections tops 19 million. More than 300,000 of those infected have died. About 1 in every 1,000 Americans have been killed by the illness. The nation's top infectious diseases expert, Dr. Anthony Fauci, says differences in how individual states have responded to the virus are a, quote, major weakness of the U.S.'s handling of the pandemic. Carter Evans reports from Santa Monica, California, where every ICU bed is now full.
We're in the ER parking lot at Providence St. Joseph's in Santa Monica. Behind me, you can see a tent here in the parking lot. A doctor told us they had overflow COVID patients in there just a couple of hours ago. December has been the deadliest month of the pandemic here, with more than 64,000 people lost so far. And here in Los Angeles County, someone dies from coronavirus every 10 minutes.
After millions of Americans crossed the country and gathered over the holidays, health experts are warning of another surge on top of a surge.
As we get into the next few weeks, it might actually get worse.
Adding to those concerns, the spread of a new, more contagious variant of the virus. After appearing in the UK last week, it's been found in several countries, including France, Australia, Japan, and now Canada. Experts believe the strain is likely already here in the U.S., but Dr. Fauci says public health officials worldwide are monitoring the situation.
Does it make someone more ill? Is it more serious virus in the sense of virulence? And the answer is it doesn't appear to be that way.
The numbers in the U.S. are already staggering. Roughly 200,000 new cases daily, nearly 120,000 people currently hospitalized, and more than 2,000 people dying every single day. Yet there are still people ignoring public health rules. In Beverly Hills, California, the famous La Scala restaurant was reported to authorities by its own customers after giving out invitations to a secret indoor New Year's Eve party. The invitation said in part, "Welcome back to the 20s prohibition." The restaurant didn't respond to a request for comment. City officials say they've contacted management. It's frustrating to frontline healthcare workers like Dr. Vanessa Walker, who says California's beleaguered hospitals may not be able to handle an even bigger surge in the coming weeks.
It feels like we are working hard every day trying to save lives, and it's just falling on deaf ears. We will take care of you. We'll find places. We'll put you in hallways. We'll put you in conference rooms. But ask yourself, is a bed in a conference room as good as the bed in a regular patient room? I don't think so.
And it appears the vaccine distribution may be going slower than originally planned. Now, Operation Warp Speed said that it had intended to vaccinate 20 million people by the end of the year. That's just 3 days from now. Right now, according to CDC data, roughly 2 million people have been vaccinated. Jamie?
It's a big difference. Carter, thank you. For more on this, let's bring in Dr. Ron Elfenbein. Thank you so much. He's the medical director and owner of First Call Medcal Center. We appreciate you being with us today.
Good morning. Thank you.
So as we just heard in Carter's piece there at the end, the massive vaccination campaign against the coronavirus in the U.S. has gotten off to a slower start, a very slower start than federal health officials had initially hoped. Is there any way the country can speed up vaccinations at this point? And what kind of impact could this slow rollout have on case numbers in the coming months?
Well, so remember that the vaccine is the federal government is handing the doses out to the states in proportion to their populations. So it's up to the states on how to distribute the vaccine to first-line healthcare workers first, obviously, and then each state had to come up with their own plan on who would get the next dose of vaccine after the frontline healthcare workers are all sort of vaccinated. So, a lot of this sort of, misuse or bad allocation of the vaccine really falls on the states, not the federal government. There's a lot to go around here, but I'll give you an example. New York has received 630 doses of 630,000 doses of vaccine. And as of December 23rd, only 89,000 people had been inoculated with it. So where are those other, roughly 500,000 doses of vaccine? Why haven't they been given out? And you can go state after state after state like that. My brother, he lives in Colorado, and he lives in a very small little town. and pretty much they were inoculating everybody. He said that the IT workers at the hospital, the janitors, everybody was getting inoculated. Now, the IT workers are obviously not frontline workers. So why are they getting inoculated instead? For example, my wife is a pediatric oncologist at Johns Hopkins. She hasn't been inoculated yet. So, but that's because I live in Maryland and he lives in Colorado, and he's in a remote town in Colorado. So the states have to distribute the vaccine, and then it's up to the federal government, distributes it to the states, and it's up to the states to come up with a plan on how to distribute it. And some of the states just haven't really been up to the task, and it's a logistical nightmare. I'm going to be honest with you. This is not an easy task. You have to figure out who's going to get it, when are they going to get it. You got to schedule them. You got to schedule the first dose, then you got to make sure they're available to get the second dose. Someone has to track all that. I mean, it's a lot of paperwork, and it's a big deal. So it's not an easy thing.
Well, we've seen pushback in some states too. In California, just last week, there were people who were coming out saying, "Wait a second, I'm a frontline worker and I haven't been vaccinated yet." But like your brother, some of the IT people or behind the scenes people are getting vaccinated. So is it the states? Is it a mismanagement once it gets to maybe the hospitals or the nursing homes where it should be distributed, or is this just one big mess?
It's all of the above. I have friends of mine who at some hospitals in Maryland, for example, who tell me that, I got my dose. I got it, no problem. It was very simple. The hospital that I work at, it was great. It was very well managed. It was very easy to do. But I have friends of mine who said that they're ER doctors like me, and they went to go get their vaccine, and in front of them was a radiologist and a pathologist, people who don't touch patients. And they ran out of vaccine, so they didn't have enough doses for the ER doctors. So, how does that happen? But that obviously falls on the hospital administration, not on the state, not on the federal government. So, like I said initially, there's a lot of this sort of, I don't want to use the word blame, but mismanagement, whatever you want to call it, to go around. But to be perfectly fair, this is a very, very difficult undertaking with a lot of logistics, a lot of behind the scenes work. While, all these hospitals are dealing with no beds, finding places to put patients, finding ICU beds, finding ventilators, all these things that they're trying to deal with, in addition to trying to get people vaccinated. So, it's really it's a difficult undertaking, but there's a lot of mismanagement all the way around.
Yeah, it's hard to wrap your head around. So I want to talk about the new variant of the coronavirus from the UK. It's now been detected in several other countries across the globe, including, we're learning, Canada. Starting today, the U.S. will require all airline passengers arriving from Britain to test negative for COVID-19 within 72 hours of their departure. Are you hopeful this measure could help prevent a surge of infections of this mutation in the U.S.? To me, it seems, when it comes to the testing guidelines, that 72 hours doesn't really do much.
Yeah, on the one hand, you're absolutely right, the 72 hours, because that gives you that window, obviously, of 72 hours in which you could become infected, and then you're on the plane and you're bringing it to the United States or wherever it is you're traveling. On the other hand, it's better than nothing, and I think this should have been instituted a long time ago. A lot of states in the United States require you, if you're traveling into the state, to get a COVID test within 72 hours. A lot of countries have been requiring that for a long time. So I think the United States should have required that, certainly for international travel. It's certainly better than nothing. The problem with doing it any quicker than 72 hours is it's very hard to get a PCR test, the sort of gold standard in testing, the polymerase chain reaction test, back any faster than 72 hours. So you're kind of stuck between a rock and a hard place there. But the answer is yes. I'm hopeful that it will do at least something to stem the flow. With the new variant, we don't really know that much about it yet. We do believe that it's more infectious than the standard variant, or the standard, strain we call it. But this obviously is not a new strain. It's a variant of the COVID-19 virus, not a new strain. But we don't know enough about it yet. We don't really know that it really truly is more infectious. We don't believe it's more dangerous, but we don't know enough yet. So I think we need more data to really get to the bottom of that. But to answer your original question, I think that the 72-hour rule should have been instituted long ago.
That makes sense. The Wall Street Journal, we were reading this morning, is reporting that doses of COVID-19 antibody therapies are sitting unused at hospital pharmacies as cases surge in states across the country. Is this another one of those points of mismanagement that you see, or why do you think this is happening?
Yeah, so that's a really good question. I was really alarmed to see that number. I've actually I just worked Christmas Eve and Christmas Day, and I sent 3 patients to get monoclonal antibody infusions. I think part of it is a lack of knowledge. So I think what a lot of people were depending on were primary care doctors sending patients who test positive for COVID-19 to get their infusion. But the problem is a lot of patients are getting tested at, outpatient facilities or at urgent cares like the one I own, and we don't necessarily send people to get monoclonal antibody therapy because we don't have that ability. So the primary care doctors are never really being brought into the loop. So there's kind of a miscommunication there, and I'm not really sure how to fix that. I think that's part of the problem. The other problem is that I think people just don't know about it, and then some people don't believe that the medicine really is that efficacious, so they don't really want to send their patients for it. But I don't think it's a mismanagement on the part of the hospitals. I think it's just people that either don't know about it or the patients are sort of not in that communications loop to be able to get that done for them, if that makes sense.
It does make sense. It's going to be interesting to see how we move forward with so many questions and variables still up in the air. Dr. Ron Elfenbein, thank you so much for being with us.
Thank you. Stay safe and have a great week.
You too.
Happy New Year.
Yeah, Happy New Year to you.